let's broaden our understanding of the knee joint. The knee is a very reactive joint, meaning that it often reacts to the way that our hip and ankle move, but we also want to be able to isolate movement from the knee so that we have a strong foundational system in our joints. So today we are going to dive deep into the articulations of the knee, or the way that the knee joint moves the shin. And if we have a deeper understanding and then can feel that movement in our bodies, we can then increase the mobility of the knee if necessary and just increase our body awareness overall of the lower extremities. So we will go through articulations of the knee, put it all together for a controlled articular rotation, or a CAR. And then I will challenge you at the end to repeat the same movement, but in a more intense way. So let's start with rotation of the shin. Yes, your knee does rotate. So usually when we think about knee mobility, we think about extension and flexion of the knee. So straightening the knee, our quads do that action, or bending the knee, our hamstrings do that action. But the knee actually also rotates the shin from that knee joint. When people tear ligaments in their knees, usually it is because their knee was unprepared for the type of torque or rotation being put on it. So we want our knee to be able to own rotation of the shin, so that when we are performing rotational activities, or even just our everyday movements where we are changing direction, our knee can withstand that rotation of the shin and produce force in that position. So rotation. We're going to start on the floor and we're going to do just internal, external rotation. I'm going to help you feel what that is. If being on the floor is uncomfortable, you can do this in a seated position on a chair or a bench. You're just going to make sure your thigh is pressed down into that bench so the thigh is not moving around, and that the heel is pressing down into the floor or a yoga block. So we're going to lock this thigh into place, because if we're moving the thigh, then we're really moving from the hip joint. So we want to isolate from the knee. So we're going to lock this thigh in place by hugging the chest into the thigh, and then we're going to brace the knee by pressing each hand into the side of it. The foot is going to stay flexed, so I'm going to actively keep flexing that foot as I'm in this locked position, and then keeping that knee nice and still, I'm going to rotate the shin. You're going to turn your toes out. Another way you can feel this movement is if you take your right hand inside of that right foot and ankle, right underneath that heel, and pull that ankle and shin into rotation. Try not to let just the ankle rotate. We want to pull that shin into rotation. And we're holding this rotation here. You can also use your hands. If you really have that tight position with the chest and the thigh, you can use your hands to literally rotate and turn that shin on its axis. The heel is driving down into the floor, and you're using the progression that works best for you to hold that rotation. This is the easy one. So now let's go to internal. You're gonna keep driving the heel into the floor, move really slowly back to the center. Then you're going to try to take your toes over towards, if this is 12 o'clock, 11, 10 o'clock. Now we're making sure that the knee doesn't slide in. That would be rotation from the hip. And we're making sure the ankle doesn't do all of this movement. We want that shin. Now, like I said, this is the hard one because this articulation is much smaller on most people than the external. Once again, you could take your left hand this time on the outside of that right ankle and pull further into that rotation. You can also take your hands and physically rotate that shin here. So taking that, whichever progression works best for you, let's do that 2 more times. Over to external rotation and hold. This is a really weird feeling at first if you're new to this, so come back and practice. It can take a little while. Back to internal. And one more time, less is always more. So if you can just move 1 centimeter each direction, we're good. You're moving that shin. That's exactly what we want. And then over to internal, and then slowly come out of it, and we'll switch sides, okay? We're gonna lock that thigh into place. We're gonna lock that knee into place. We're gonna rotate the shin from the knee joint. As you're doing this, also make sure that that left hip is planted on your bench or the floor so that we're not rotating from this disconnected position. We want to be fully connected to the floor so we can produce more tension and force in this position. Let's go to external first. So you're going to slide those toes and that shin out, and you can take the left foot inside of that ankle to pull further into that rotation. As long as you continue to flex that foot, you can also take those hands and physically rotate. Just make sure that the knee stays in the same spot. Then let's slowly go over to internal rotation. Turning that shin in. You could take the right hand on the outside of that ankle, pulling into more rotation, or take the hands on the shin and pull into more internal this way. And we're going to do 2 more. So we're going to rotate to that external rotation, driving that heel into the ground. And to internal. So we're just noticing how the shin moves from the knee and really locking in that awareness and learning about that functionality of the knee joint. And one more time over into internal. And then we can slowly come out of that position. So now let's add the flexion and extension of the knee. So this is the easy part, but we're going to focus on really feeling the hamstrings and those quads working to make this movement happen. So if you're sitting on your bench, then you're just going to kind of slide back so that your knee is just barely hanging off the edge. You're going to bend by trying to squeeze the bench with your calf, and then you're going to extend the knee, trying to cramp up those quads. If you're on the floor, you can grab your right arm underneath that right leg, shift back so you're pulling it to your chest, clasp those hands together, flex that foot again, and we're going to reach that leg straight up. So we're extending the knee. We're trying to grip those quads here as we're doing this, extending as far as you can. And yes, you might feel a hamstring stretch. That's a good thing. And then we can bend that knee, trying to squeeze either the bench or your chair or your arm with your calf muscle. And then let's do that again. So we're hinging at the knee. So the thigh shouldn't be moving away from you as you extend. You're just going to extend as far as you can without letting it slide away. Now, if you are locked in a position with the leg further away from you, then that's where you're going to hinge at that knee. Make sense? So let's do that one more time. We're squeezing, 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 back into extension, reaching up through that heel. Once again, make sure that right hip is glued to the ground, and then bend, trying to squeeze that arm with the calf, and release. Let's do that on the left side. So grab underneath that left leg with the left arm, clasp those hands together and pull it towards your chest. Doesn't have to be glued to your chest. It could be in this same position, but we are hinging at the knee, so that thigh shouldn't be moving closer or further away from you as you extend. So go ahead, extend that knee, try to find those quads gripping, hamstring stretching, reaching up through that heel, and slowly bend that knee, squeezing your arm or the bench or the chair. And then we'll do that 2 more times. Extend, reaching up through that heel. And bend, focusing on isolating and hinging from that knee joint. So your knee is a hinge and your leg is the door. And last time, pulling into flexion. And release. So now let's talk about how we rotate our knee in that extended position, because we don't always rotate the shin in a deep knee flex position, like let's say a squat, right? I'm internally rotating my shins in this deep flexed position. What if we're in a single leg deadlift and we're rotating here? Or we are pitching and we're rotating on top of that mostly extended leg, okay? Then how do we rotate the knee? So we can either stay on the floor and clasp your thigh with your hands underneath, or if you're on your bench, we're going to go to a similar movement as in the beginning. You're just going to scooch further away just a hair so that we can place that heel on the floor, and then we will lock that knee and thigh into place as we rotate from there. All right, so let's go with that right leg first. Hip is down, foot is flexed, leg is mostly extended, and you're locking that knee into place either by gripping either side or underneath, which I think gives the most support and isolation to the knee. So it's just very slightly bent. Drive that heel into the floor so we feel some hamstring recruitment. And then let's do 3 more rotations here. So now this is almost like a test. We're really just working on how well you can isolate and rotate that knee with that foot so far away from you. The movement is going to be smaller. And let's take that 2 more times over to external, keeping that knee nice and still. And over to internal, really focusing on rotating that shin. And let's go 1 more time over to external and internal. Keep that knee nice and still. And if you do move it, try to pull it back. And release. Let's try that on the left side. So I have a mostly extended leg. Make sure that left hip is pressing down into the floor. I've got some tension down into the floor with that heel. Foot is nice and flexed. So let's go to external first. Rotating that shin. Keeping that knee nice and still. And over to internal. A lot of this is just like patting your tummy and rubbing your head. It feels very counterintuitive. And then back to external rotation. Very small movement. And internal rotation. Keeping that knee nice and still. And 1 more time over to external. Moving slow back to internal. Keep that ankle nice and active and flexed. You will get a little more movement if you keep that ankle active. All right, so let's slowly come out of that and let's put it all together. We have rotation with the knee bent. We have extension of the leg. We have rotation with the leg extended and then back to flexion, okay? So this is our controlled articular rotation or our CAR. So we're gonna get in the same base position. I'll show you from this angle. I'm gonna wrap underneath my right leg with my right arm, clasp my hands together, flex that foot. I'm in this locked position with my thigh. Make sure that that right hip is into the floor. Flex that foot. Let's start with external. We're just doing 3 of each. So we're gonna externally rotate. You're gonna keep the external rotation as you extend the leg as far as you can. At the top, you're gonna internally rotate. Do this really, really slow. It's very small. And then bend the knee, trying to keep that internal rotation. Back to external. And then extend. Keep that external rotation as you extend. Here's the hard part. You can sometimes cueing this knee right here helps to feel that internal rotation without moving that knee, right? There's that rotation, very small. And bend, and then we're gonna do 1 more external and extend. Internal at the top and bend. Now let's reverse it. So we're gonna extend with that internal rotation and then externally rotate and bend. Back to internal. This one's a little bit easier. Keep the internal as you extend. Then at the top, we can go to that external rotation and bend. And we'll go 1 more time, internal. Keep that thigh close to the chest. And external and bend. All right, let's release that right leg and let's go into the left leg. I'm gonna show you from this angle. As we're going up and down into this knee flexion and extension, with the rotation, it sometimes can take this oval pathway, and we want to avoid that. So we want to try to rotate and move that shin on its axis. So we don't want the heel to sweep across into that rotation. We want to rotate on its axis, right? As if that heel were planted into the floor and as if you're sliding it straight up a wall. Okay. So foot is flexed, we're in this locked position. We're gonna externally rotate to start. Keep that external as you slide the heel straight up. At the top, you're gonna internally rotate, small movement, and bend. We'll go back to external and extend. And internal, very small, and bend. Try not to move from that hip. We'll go one more. External, extend at the top. Very small rotation, internal, and bend. Now let's reverse it. So we're going to start in that internal rotation and extend. Once we get to the top, let's externally rotate. Very small again, and bend, but this one is slightly easier. Back to internal, extend, back to external, and bend. We're going to go one more time. Internal, and extend, and external, and bend, and rest. So the reason that doing those knee cars this way is such a leap from doing rotation here is because the knee cars are an open chain movement, meaning that the foot is not connected to anything. So we don't have anything to use as leverage to get more rotation. The capsule cars here are closed chain. So we have that connection to the floor, and we can use that as more leverage for rotation. So if you're getting confused when you all of a sudden take it to an open chain, go back to the closed chain, the capsule cars, and perform those rotations until we can move into the open chain movement. So now for our challenge, this is going to be the same movement, our controlled articular rotation. However, we're going to do this in a hip extended position. The muscles that help primarily move the knee, the biggest muscles that move the knee are the quads and the hamstrings. There are other muscles that help with that movement and rotation. But in our hip flexion position with the leg pulled nice and close, it's easy to access those quads, but the hamstrings are not getting as much work in. So if we do this in a hip extended position, from standing up, we're going to squeeze a yoga block between the thighs, and we're going to do this same movement. So you're going to hold on to something for support, squeeze that yoga block. Now that's going to make sure that the hip doesn't rotate here. The more you squeeze the block, the more that hip is going to be locked into place as you rotate. So we're going to stand on one foot. This knee can be slightly bent, the right leg. We're going to kick behind you just slightly. And we're going to squeeze that yoga block. Now we're going to do our knee car. So you're going to slightly externally rotate and then bend that knee, trying to kick your butt this time with your heel. So that's going to use your glutes and your hamstrings to bend the knee. The hamstrings also help extend the hip, kicking your leg behind you, so you'll feel lots of hamstrings working here. Then at the top, we're going to internally rotate and extend. Let's do one more in that same direction. I'll show you from this angle. We're going to externally rotate and bend, internally rotate, and extend. Now let's reverse that. So we're going to keep the internal rotation as we bend, externally rotate at the top to extend. One more, internally rotate to bend, externally rotate to extend. All right, let's shake it out, and then we'll switch sides. If you cramped during that movement, that's common and normal, that's fine. The more you practice, the easier it will get, the more the cramps will subside. So we'll go with this left leg. We're going to slightly bend the left knee, kick behind you just slightly. That's already going to engage the hamstrings and the glutes. We'll start with that external rotation again. Very small movement, all from the knee. Squeeze the block. We're going to bend, keeping that external rotation. At the top, we're going to internally rotate and extend. And then we're going to go back to external and bend, internal, and extend. Now we're going to reverse that movement. Keep the internal rotation as we bend as high as you can get that heel. External to extend. And we'll go one more time. Internal to bend. Keep squeezing the block as we externally rotate and extend. All right. That's it. Practice this. Get really comfortable with this. Know the ins and outs of that knee movement, and then we can improve the mobility of that knee and the resiliency of that knee to prevent those injuries from happening. I hope you learned something today about your knee mobility and knee movement. If you have any questions about this movement, drop them in the comments below. If you found this helpful, please share, like, and subscribe. And thank you so much. I'll see you next time.